Welcome back, my dear awesome medicos, to the Praxis Med. You are watching my clinical case series where I am going to teach you think beyond the pages, question appropriately, and most importantly, master the clinical words. I've got a massive case to break down with you today. So, without any delay, let's roll the intro. Raghav, a 7-year-old child, came to the paediatric OPD with complaints of swelling over the face and body for the last 14 days, and excessive tiredness and generalized weakness, and also reduced appetite. Mother noted that Raghav is no longer interested in playing with his friends. He is tired, lethargic, irritable, and has a significantly reduced appetite over the past few days. The mother mentions the urine seems frothy or bubbly when he uses the toilet. So we have a 7-year-old child with the symptoms of facial puffiness, tiredness, weakness, abdominal distension, and frothy urine. So we can say these are the classical features of nephrotic syndrome, but we should also keep in mind that there are other differentials for this condition, which includes liver cirrhosis, congestive heart failure, and severe malnutrition. So through the course of the disease, we should exclude these differentials based on the further findings from the patient. So on examination, there is bilateral pitting edema over lower limbs and feet, and there is abdominal distension with shifting dullness, so which suggests ascites. So furtherly, we have lab investigations. So we have a complete urine examination which shows proteinuria of more than 40 mg per meter square per hour, and a dipstick score of more than 3 plus, and a protein-creatinine ratio more than 2, and there is hypoalbuminaemia, so where the serum albumin is less than 3 gram per deciliter, and there is hyperlipidemia. So the hallmark features of nephrotic syndrome includes massive proteinuria, so which we found out in the lab investigations, which is more than 40 mg per meter square per hour or 1 gram per meter square per day, or from the dipstick we can know it is more than 3 plus or 4 plus, and there will be selective proteinuria which is albumin, so hypoalbuminemia will be present. So due to extreme loss of albumin, there will be decreased oncotic pressure, so which leads to anasarca. So to compensate this condition, the liver will produce the lipoproteins and lipid in excess amounts, so which leads to hyperlipidemia. So in the differentials, we could think of liver cirrhosis, whether it is liver cirrhosis or not. So basically, liver cirrhosis will be presented with ascites, and number 2 is portal hypertension or signs of the portal hypertension. You can see ascites in this patient, but there are no signs of portal hypertension. So the signs of portal hypertension includes caput medusae, spider nevi, also we can say esophageal webs. So these are the signs of portal hypertension. Congestive heart failure. So in congestive heart failure, there will be no protein abnormalities. So but we can see here prominent protein abnormality. In severe malnutrition, we could expect chronic history of malnutrition, but in this case the history is very few days. It is around 10 to 14 days. So we can exclude severe malnutrition, and also in severe malnutrition there will be history of chronic diarrhea or persistent diarrhea, which is not present in this case. So with all these findings and ruling out the differentials, we can come to a diagnosis, so which is the nephrotic syndrome. Since the patient is a child, so we can expect it as a minimal change disease, which is the most common presentation. So other presentations would be focal segmental glomerulosclerosis, so which is FSGS, and mesangial proliferative glomerulonephritis, MPGN, and C3 glomerulopathy. And to differentiate it from nephritic syndrome, so there are findings in nephritic syndrome which includes and also mild proteinuria, and there will be history of hypertension, and there will be periorbital puffiness which will be localized. So it is localized to periorbital puffiness, and the most important, cola colored urine. So based on these findings, we can differentiate nephritic from nephrotic syndrome.